PhD projects. And so on the 1st of September this year, I'll have actually been at the Centenary for 14 years. So when I started, Professor Baston was the director, and I'm sure he doesn't remember me at all, but I certainly do remember.
This is beautiful.
Well, if you do the calculations, I was actually only 8 years old when I started. I'm not sure about your policies of employing people. So the area that we focus on is heart disease. And really, when you think about heart disease, usually you think about people who are overweight and who don't look after themselves. And what you don't think about are the young people, the people that we see in our clinics, who, through no fault of their own, inherit a genetic fault from their parents and develop these potentially life-threatening heart conditions. And these are the families that we're interested in. This is just two of the families that we've seen in our clinics. And these families come back basically every year. So, we might see a family for the first time, but then, we become like part of their family. We see them every year. We see their children grow up. We see the kids come back to the clinics with their children, and we're really close to our families. And these are just two of those. This is a family here with a condition called long QT syndrome. This condition came about in this family because this lady here got up early one morning, said goodbye to her husband, who was a truck driver, got back into bed with her two young daughters and had a cardiac arrest and died. And her young daughters, one of them I think was about 8 years old, had enough sense to jump out of bed, run next door to get the neighbour who was a nurse and alert people that something terrible had happened. And through then screening of the family, these are inherited heart conditions, so relatives have a 1 in 2 risk of developing these conditions. Through screening and then through genetic testing, we're able to identify a whole heap of other relatives who potentially now, through management and treatment, won't have that same outcome. This is another family. So this is a family with hypertrophic cardiomyopathy. This is probably the most common inherited heart condition. It affects about 1 in 200 people, so not an uncommon disease. And this is a family, this lady here, she came into our clinic probably 15, maybe even 20 years ago. And when we took her family history, she had her mother who died suddenly, her brother, her uncle died suddenly, these grandparent and the grandparent's brother died suddenly. Her brother died at the age of, I think it's 16 years. So just this absolutely terrible family history of sudden cardiac death. And this is actually not a typical family, but basically nearly everyone with disease in this family has died suddenly. And this lady herself had a heart transplant a few years ago and is now doing well. But these are the sort of families that we deal with. So obviously the issue is sudden cardiac death, and this is an issue that there's no coming back from it. If you don't predict it and if you can't prevent it, you don't often get a second chance. So this is what basically all of our research focuses around. The most recent thing that we've done is we've done a big bi-nation study in Australia and New Zealand to look at the incidence of sudden cardiac death, and what we found was that sudden death occurs at a population level of 1.3 people per 100,000, and this is sudden death under the age of 35, so not including older deaths due to coronary artery disease. And a couple of the interesting things about these findings were the most common cause of a sudden death in a young person is actually unexplained. So they'll do the post-mortem, check everything, and there's no cause of death. No reason to suggest why someone might have died. And so the conclusion then is that it's likely to have been an arrhythmia. And the other interesting part was this increase in risk over age of the 16 to 20-year-olds. So if something happens, probably relating to hormones and growing, that seems to be a bit of a trigger for sudden death events. So obviously sudden death is terrible, and as a genetic counsellor, this is something that I'm interested in terms of how the family is managed psychologically. And Laura Yates, who's in the audience, who's also a genetic counsellor, and she's been with us for 10 years, We did a project together quite a few years ago now where we did some qualitative interviews with these families because we knew from seeing them in our clinics, and we have probably the biggest experience of sudden death families in Australia and probably competitively internationally as well. But we knew from seeing these families that they never recover and they have so many ongoing issues. And so our qualitative study was the first study in the world that actually looked at this particular patient population. And what we found was that they have, a huge number of issues. And we followed that up a few years later with some quantitative psychological scales. And what we found was that every family member that we see, 1 in 2 of them have either post-traumatic stress or prolonged grief in a clinically significant range that would require intervention with a clinical psychologist. So that's, imagine these people are in their 30s, 40s and 50s. These are people who should be going to work every day, should be looking after their other children, and they're managing these psychological symptoms. So clearly for us, this was a bit of a wake-up call that we need to start integrating more psychological care into our clinics. So I think it's important now that, this is the problem and this is the work that we've done, but really as researchers, we want to look forward and work out the ways that we can try and help these families. So the biggest thing really that we're trying to do is these families need multidisciplinary care. They need the care of a cardiologist, they need genetic counsellors, they need nurses, we need input from the forensic pathologist, but they also need a clinical psychologist. And when we published that study, there was no recommendation, no guideline, no information in the literature at all to suggest that a clinical psychologist would be useful in that setting. So we've actually started to develop links with Sydney University School of Psychology, and throughout the last 12 months we've been carrying out a needs analysis. So we've had focus groups with parents and worked out what it is that they think is important, and we've had a student working on it. We've got some really nice qualitative psychological models that are starting to come out, and for the first time we're actually going to be able to give really good advice to the rest of the world about how these families need to be looked after. So the other important things that we're doing looking forward is genetic testing is a really powerful tool, and genetics is really our strength of our group. And by using genetics in these families, it helps us to better define risk. So what we do is we take DNA from the postmortem, we perform genetic testing, and at the moment we're doing either whole exome or whole genome sequencing. So that means we look at all 22,000 genes, or we look at the entire genome, and we try and look for the underlying genetic causes that have caused that death. And what that helps us do, this is one example from one of the families in our clinics. This is a man who died suddenly, no previous known heart condition. He had a young daughter and one day just dropped dead. The post-mortem was unequivocal. There were some changes, but nothing that would give a diagnosis. And genetic testing of a paraffin-embedded tissue sample actually showed that he had a particular change that basically gave a diagnosis to this family and gave advice on how family members should be treated because it is such an arrhythmic phenotype. So this is now really important, and this explains some of the symptoms that his mum had. And now there's a lot of question about the 8-year-old daughter who can at least grow up knowing why her father died. The second reason, this is also one of our families, and it's probably the nicest illustration of how genetic testing can be really useful. So this is a man here who died suddenly at the age of 42 while out jogging, no previous diagnosis. Through genetic testing, we're able to identify the genetic cause, and he had hypertrophic cardiomyopathy. This man was coming in for clinical screening every couple of years, really anxious all the time. He'd lost his brother to this condition, and he was so anxious that he might have had something that he could pass on to his children. So finally we found the genetic cause. We're able to test him to see if he carries that particular change, and he came back negative. And for him, that was the biggest relief ever, because it meant he never had to come in. He can't pass anything on to his children, and he can basically get on with his life knowing that at least he doesn't have to worry about that risk. So the other things really that are important for us is raising awareness and educating the community about inherited heart conditions. Some of them are relatively common, like hypertrophic cardiomyopathy, but a lot of them are rare. And so we have the Australian Genetic Heart Disease Registry, which is a resource for research, but we also use it to educate the community and patients. And we've got a Facebook page, we have newsletters, lots of different things. And that's it. So just thanking the rest of the group. I'm just one person. There's about 15 or more people, as I said, led by Professor Chris Devsarian. And yeah, thank you to everyone for all of your support. We can't do what we do without the support of people like you, so thank you.